Hello, welcome to my podcast and my YouTube channel. Today I have a Brazilian with me. I think you are the second one I interview. It's not very easy to find Brazilians to talk on my show because, of course, the language doesn't help. But today we're going to hear from my guest is Juliana Falcão. She specializes in self-harm, self-mutilation, and that's she's a psychologist in Brazil. And that's what she works with, and she's also an author. And I'm going to ask her to talk about it because it doesn't really help if I tell you the title of the book. It's in Portuguese. It's not in English yet. I'm sure it will be at some point. But Juliana, thank you so much for being with us. Welcome to the podcast.
Thank you for having me, Paula. It's a pleasure to be here.
Sure. Tell us a little bit about what your book is about.
Okay, so my book is based on my doctorate research, my PhD, which was with self-harm. I talked about self-harm in general, but also self-harm in prisons, confined environments, because I worked for a while with young offenders, so teenagers who committed crimes and were serving time in an institution. So I worked directly with girls exclusively, and we had some cases of self-harm, some of them very severe at the time. So part of my research was with that. And my book is about self-harm in general and also with that.
So it brings like stories too.
Yes.
It's not just an educational thing, but it also has cases.
Yes, it's very clinical. It's theoretical and clinical.
Is that why were you interested? Because this is a tough area. It's very heavy, difficult. I know that not everybody can really work on this area. What brought your attention to that?
So I started being interested in self-harm when I was close to graduating from university. I was studying psychology, and I had heard that a friend of a friend was self-harming, and that was the first person I heard of at the time. I didn't know anybody else who did that, and even in psychology course we didn't talk about it very much. That was about 14 years ago. So I decided to write my final work, my final paper about self-harm. I had a really hard time finding references. So books about it in Portuguese, there was almost nothing. So I found some books in English, mostly research from United States and the UK. There was a lot of research at the time.
You're talking and it's like I'm hearing myself talk, because also when I started, being interested in suicide 15 years ago, so pretty much the same, I found nothing, and I bought books from the UK and the US. So it's sad. I mean, but I'm curious now, because with suicide, it has progressed a lot. It's really advanced now, much, much better. My book was practically the first in Brazil about suicide, and I'm sure yours was one of the first too. But has it changed? Are psychologists, mental health professionals more interested now?
Yes, it's changed a lot. We have a lot more information now, scientific papers, books about self-harm, but mostly about, case history,
studies,
qualitative research, not a lot of data. It's still hard to find, like, what's the percentage of teenagers who are self-harming. So not a lot of data.
You still don't have those numbers in Brazil?
It's hard to find. We have smaller studies.
Okay.
For example, in smaller locations, but not very broad studies or over many years, for example, like we have in other countries. Like when I was in England studying during my PhD, I was to England and talked about that with a psychiatrist, and he was involved in a study that was following some teenagers throughout 8 years. So they could get a lot of information. We don't have still those kind of studies here, not that I know of. And books, not many books as well. Mine is one of the few that specifically about self-harm. But in psychoanalysis, we have a lot of people talking about some cases, some patients. and really.
But it's more anecdotal, so individual cases. It's not like groundbreaking or a large number of data.
Right.
Well, I'm going to ask you, but I'm sure you know worldwide, or you have some specific numbers, because I'm curious to know the demographics. For example, what is the profile of this person? Who is self-harming? Are they usually teenagers? Is it a gender thing too? And more women or men self-harm? Can you give us an overall view of who we're talking about?
So the demographics is that there are some really, like I said, broad studies about that. I'm thinking about one specifically which talks about, I think it's from 2015, but it's really, really broad because it collects data from 41 countries with a lot of subjects. So what they found was mostly teenagers. The starting age usually is around 13, 14 years old. It's more prevalent in girls than in boys. And another thing that they found that I think is interesting is that around 50% of the people seek for help.
Really?
Yes, but usually it's help from friends, not from professionals. So it's really, I think this is something that we need to talk about a lot more so that these people can search for help.
Well, but not only that, but I'm thinking too that maybe in schools, if they're searching for help with friends, most of the times they'll be in school, right, together. So if schools addressed this issue, do they do that at all in Brazil?
We're talking about that more with the schools, and in the last 5 years, I think I have been receiving a lot of cases in my private practice. I have been treating more people, and I have been hearing more people talking about it. So some colleagues that work in hospitals or psychologists who work in schools, they are searching for professionals to go to schools and talk about it, or they are searching for supervisors. Some people, for example, a few weeks ago, I had a psychologist who works at a school and had a very severe case of a girl who was cutting at the school, and he came to me to know more and to talk about it and to understand better and to see how to deal with it.
Yeah, it's kind of similar with suicide, though, in the way that when you open the door, when you start talking about it, these cases just come, right? I'm sure that it happens to you like it happens to me.
Exactly.
Oh, I have a podcast on I work with suicide prevention, and people, and then they always have a story to tell. So it is a matter of breaking the stigma and the silence too with self-harm.
There's a lot of stigma involved. There's a lot of shame. And the teenagers are very ashamed to talk about it because sometimes they are punished if the parents find out that they're doing it. So it's a very hard topic to talk about. And sometimes there's some idealization around that, like it's something cool and something that they can do to impress other friends. There's also that.
Really? So that's unimaginable to me. And I have one. Is this a new thing? Because I don't remember from my teenage years, and I don't want to say how old I am, but it's been a while. But I don't remember that being around, or maybe the stigma was even worse and people didn't talk, or it was just not as prevalent as it is now. Because I don't remember that from my teenage years. Yeah. Is this a new phenomenon?
It's changed a lot. It's not exactly new because we have some data that shows that, for example, there are the first psychoanalyst who talked about it was in 1934. So there were cases back then, but
not as prevalent. I mean, it wasn't a collective thing, right?
No, it's a lot more frequent now. I would say it changed a lot in the last 5 years, for example. And I think the internet plays a big part in that because it has a contagious effect.
Yeah, nature, right? Yeah. Yeah.
So if a teenager goes online and sees that, oh, someone is feeling miserable and they cut their arm and they're feeling better now, so I'm going to try to do the same to see if I get some relief as well. So
yeah, it's really amazing how close it is, the phenomenon itself with suicide, because contagion is huge too with teenagers, as you know. So it is a matter of, and also the example that they have, right? They go online and, as you said, they look at it, so, well, this kid is cool, so in order for me to be cool, maybe I should try this. Wow.
It's the internet thing is very worrying. I was looking at a YouTube channel of a girl who used to self-harm, and now she says she doesn't do it anymore. But she was talking about those online communities that some of them were very helpful in the sense of
support,
saying that they should look for professional help and everything. But in other communities, it was very damaging, because they would sometimes really stimulate, or they would say things like, your cut is not as deep as it should be, you're not really a cutter, or
so
come
they're
on,
like
you're not
daring them to go.
Yes.
Wow.
So it's really
so
worrying.
what are the common causes? Because I think that's one of the main questions we have. What leads a teenager or a person to self-harm?
There are many causes. I think one of the most important things for us to be looking for is what self-harm represents to each individual. Because, for example, one thing that's very common when you ask about self-harm, about the whys, many people would say that is a way to taking emotional pain and transforming it into physical pain, because that way would be easier to handle, or turning the pain in a more concrete thing would be easier to address. So some people, for example, say that they cut when they are feeling very overwhelmed or anxious about something, and they cut to get relief, to calm themselves down, while other people say almost the opposite thing. They say that cut when they are feeling numb, so that they can feel alive, that they feel that they are feeling something. I had a patient once that said, I need to see blood to calm down, to feel calm. So I need to see my blood. So there are many different purposes, I would say, to self-harm. And
that's very interesting. I hadn't thought about that, because usually I have studied some of it, and I've interviewed before about self-harm, but I most often associate it with getting rid of emotional pain, as you said, like materializing, right? Materializing the pain, and also a cry for help, because emotional pain is silent, naturally silent, right? But if you have a cut on your arm, then people will see that you're suffering. So it's a sign that there is something wrong, and maybe
a message.
It's a message that you send, and one that can be seen, right? Differently from emotional pain. But there is that part too, that some people don't feel, and you were talking, and I remembered a client of mine who, the first session, he just sat down on the chair, and I started asking him what had brought him to therapy, and he said, I can't feel anymore, and I need to feel again. So it just brought me, that memory of that client, and it makes sense, right? Because it does make you feel.
It takes your attention away from other things, like when we have a really bad headache, or we sprain our ankle or cut our finger, for example. We tend to get our attention to that and not think about anything else.
I know pain does that, right? Once you're in pain, there's nothing else going on.
Yes, so it's a way to distract from feeling the feeling and focusing on other things.
Let's talk about suicide and self-harm, because I know that there is kind of discordance, or I don't know how you call it, but different views on what
Yes.
self-harm is and what it means. Some
Mm-hmm.
people think that it can be a sign, a warning sign to
Mm-hmm.
suicide, and others say it can be the opposite, it can be a protective factor. So what is your view on it, and what is the general view of this
Mm-hmm.
relationship between self-harm and suicide?
Yes, it's still not, there's no scientific consensus about it because there are these two different views. And I would say neither of them are right or wrong, but they're just different ways of seeing it. So yes, there are some clinicians and authors who see self-harm as a risk factor, as a warning sign that if a person is self-harming, they are at risk of suicide. So they should be treated. On the other hand, we have some clinicians and authors who understand that self-harm can be a protective factor. It can almost prevent someone from committing suicide, or that is a kind of compromise. Like, I don't want to take my life. I want to keep living, but I can't keep living the way that I am now. So I have to do something to make myself feel better, or to cope, to move on. I don't want to end my life. I just want to keep living.
Yeah.
It's two different perspectives, because suicide would be like a permanent solution, or
The
an
old
act.
saying, right? The old saying, permanent solution for temporary problem.
Exactly. And self-harm is a kind of compromise. But of course, what I think is that if someone is self-harming, they're not okay. They're probably suffering. And what we see is that people who self-harm more severely or more often, they can be at risk of suicide, because
Can
there
be a
is
step up, right?
yes, because it can be a progressive thing, like an addiction, for example. They need to do it more and more often and more deeply to feel the same. So maybe suicide would be the next
step, a natural step. Yeah. So how to know? How can you know?
Always, I think, talking to the person and observing, you know that if it's like an experimental thing or a superficial thing, or if it's a really severe thing. So someone feels really out of control with self-harm, like they can't stop doing it, or they don't have any other resources to deal with pain and discomfort, anger, sadness. They always are looking for self-harm more and more, than it's a risk.
Yeah, so ask, right? Try to understand what's happening in their lives, and see how you can help. I have a question here that was sent by one of my listeners, and I just want to take the time to thank all the listeners who did send questions. And since you mentioned it, so it's related. That's a very good question, actually. He said, is there a connection between self-harm and addiction? Are they the same thing or related in any way? The need for distraction and self-soothing seems strong in both cases.
Yes, that's a very good question, because there is a connection between self-harm and addiction. If we think about this cycle of addiction, the tolerance, I think that's what it's called. Like, you have to
level of tolerance.
Use more and more drugs to get the same effect you used to get before, or more frequently. And many people say that about self-harm, that sometimes they need to cut deeper and deeper and more often to get the same relief, or that sometimes they feel they can't control, they can't stop. So there is a similar cycle. There are some authors who see this connection in a very specific way. So I know a book, I'm thinking about it now. It's called Secret Scars: Uncovering and Understanding the Addiction of Self-Injury. It's this book.
Okay, that's good. So it puts these two things together.
Yes, it treats self-harm like the same mechanisms as an addiction, and for her it should be treated like the same thing. And I think in some cases, yes, we can see very similar mechanisms, because it has an element of trying to escape or trying to be numb to difficult feelings. But of course, not all the cases. Like I said, we have to be really careful when we are listening to someone who's self-harming, because like I said, it serves different purposes. So for some people can be, for example, self-punishment or trying to punish other people. For example, I'm thinking about a patient I had. She said she cut her arm and then took a picture and sent it to her boyfriend and said, look what you do to me, or look what you make me do. So this is a very different position from someone who, for example, has a fight with their parents and go to their room and cut alone and hide it and don't tell anyone. It's completely different positions. Right?
And you have to talk, right? And you have to try to understand what, as you said, the meaning of self-harm is. What is the purpose of self-harm? And coping, you're talking about coping. I have another question that was sent to me. It has to do with coping strategies. And the question is, what are some of the coping strategies, healthier coping strategies? And this is someone who has suicidal ideation, and he shared with me that it's really hard for him. Isolation is a trigger for self-harm. And also the fact that he is in pain, but he doesn't know how to share it, and all the stigma and the shame associated with it. So this is kind of a long question, but it has to do with how can we promote and maybe fight the stigma, and what are the coping strategies that you would suggest? What is healthier, right?
Yeah, this is very important, because from what I've been seeing, talking about self-harm, usually we get two ends of a spectrum. On one end, we have not taking it seriously, thinking that it's just to get attention, it's not a big deal. And on the other hand, on the other end of the spectrum, we have, for example, taking it too seriously, in the sense of associating with a disorder, for example, personality disorder that needs to be treated with medication necessarily. And I think neither of them are very helpful. That's what causes the stigma, because if you want to talk to someone that you are self-harming and you get one of these two,
you shut down, right? Chances are you're going to shut down.
So I think what can be done is first start talking about self-harm a lot more, so that people see that it's not as crazy or strange as it seems, that these people are trying to feel better. They're not trying to...
It's a coping mechanism, unhealthy one, right? But still a coping mechanism.
And I think the best way is to really try to seek for professional help, because when you're talking to a friend or a family, they will be worried, and they will try to help you, but maybe not in the best way. And if you're talking to someone who studies that, who understands, they will probably feel better to talk about it, feel not judged.
Yeah, not judge. And also they'll know the skills that they need to teach you, right? And better coping skills. And we'll talk about, let's go to parenting now, because I'm sure that we know that it's mostly teenagers, and there's so many parents struggling with this with their kids. And I actually received a recorded question. I'm going to play it to you right now. It's from a parent. So I'm going to play, and then I have a couple of questions on how can we help parents deal with this. So here's the question.
Hi, Paula. Here's my question to your guest of today. It's a multi-part question. It's notably hard to ask young people about self-harm and or suicidal behaviors when they're undergoing risk assessments, as well as in conversations. Should you be direct, or is it better to build up to it somehow?
So is this because this is a very common question with suicide too? Should you ask? Should you ask, or
Yes.
just pretend? How do you ask the question, right? So it's the same thing here. Should you be direct, or you go just around and build it up as you go?
I think you can always be direct, because if the teenager is doing it, they probably know that one is on to them. Let's say. So I think the first thing is try not to panic and not to treat it like they're crazy, or try not to freak out. First thing, I think you can calmly address it directly with the teenager. For example, saying, I've been seeing some cuts on your arm. I think you may be doing this to yourself. Am I right? Or if you are doing this to yourself, you know, you can talk to me about it. So what's going on? And if they don't want to talk to you, parent, about it, because it's common, because sometimes they feel ashamed, they don't want to worry you in many cases. They feel that they are going to be punished if they admit that they're doing it. So you can say, okay, it's okay that you don't want to talk to me about it. I understand. So let's seek for professional help together. Let's try to find a psychologist or a mental health professional. I want to help you. Like, show concern, show that you're concerned, but not that you are panicking, for example.
Yeah, here's my question. I'm thinking with the parent mind now, and I'm seeing my kid as they are now all the time online. And the first thing that would come to my mind would be, I'm going to take that phone away, because I'm sure that's where it's coming from. So how should they deal with social media, with the online world? And of course, the always danger of contagion.
I think the best way is to, again, talk directly to them about it, because what happens online is they can find help and they can find support, but sometimes they are not mature enough to judge if what they are reading, seeing is helpful for them. So maybe talking to them, like, what kind of websites are you reading? What kind of blogs? Can we look at them together so we can decide if it's helpful for you or not, for example?
Okay, so sit down with them.
Yes, I think so. It doesn't help to isolate or to take the phone away, because they are
it's their life
made,
now, right?
Yes, they are born into this this digital world. So you can't isolate them, because that will cause even more suffering, more pain.
Yeah. And I like that you talked about punishment, because it's the first thing you do. I mean, how can I punish, right? It's not about punishment. It's like, it's the same thing again, how close these two topics are. It's like suicidal ideation. You don't punish someone for being in pain. You try to help them. You try to find out what the pain is coming from, and ways to help, right? And more healthier coping mechanisms. And as you said, sometimes friends don't have that. You know, they're together in the same boat, right?
Yes, and we know that adolescence is a very, very complicated phase to go through, with all the changes, mental, physical changes in their bodies. Sometimes they're very self-conscious, very ashamed of their body, and feeling really out of control. Self-harm also comes into place in this control thing. Some people say that they feel they can't control anything in their lives because their parents don't let them do anything. They can't control their bodies. That's changing their hormones. They can't control their friends who won't talk to them, or bullying that they're suffering. So self-harm sometimes for some people is really a way to say, okay, this I can control. I can cut this deep. I can take care of this wound and see it healing. And
it only depends on, it's totally dependent on me, right?
Yes, I can lock myself in my room and do whatever I want with my body. So sometimes it's very much about control.
Yeah. Well, Juliana, thank you so much. Just overall, the one thing that I'd like to just go back to are the meanings of self-harm. So just add to what I don't remember, okay? So what can it mean to different people? It means feeling again because they're numb. The opposite, because they're feeling too much, they're totally overwhelmed. So they're trying to get the attention elsewhere because they're hurting too
Mhm.
much. So you just mentioned control. It has to do with control, regaining control over something in their lives because they don't have
Mhm.
control over anything else. What else? What am I missing?
Self-punishment. Sometimes
Self-punishment, yeah. Punishing
they did
others.
something wrong. Yes, punishing others. Sometimes, and this is important, sometimes it is to get attention, but in the best way, because we say that it's not helpful to say that they are doing this for attention, but sometimes they are doing this for attention because they really need attention.
Yeah.
So I heard from a patient once. She said, I had asked my mom to take me to therapy many times before, and she was always postponing it. And I had to cut myself so that she believed I was
It was
hurting.
serious.
Yes.
Oh,
So
wow.
sometimes they need attention. They need someone to
Yeah.
validate their feelings. And
Same thing with suicide again. That's where they meet again. Many times they say, oh, they're talking about suicides just to get attention. Yeah, so
yes,
give them attention, right?
exactly. Yes.
Listen.
Mhm.
Well,
Listen,
Juliana, thank
that's
you
key.
so much. Yeah, thank you so much for your time, for your knowledge. I'm so happy that I can find
Yeah,
sometimes Brazilians like me to be here and to share what
that's
they
great.
know. And if you can, I would love to have like a list of good books in English. Sorry, Portuguese won't help.
Mhm.
But
Okay.
in English, if you can send me like
Mhm.
3 or 4 that you would really recommend to parents or people
Mhm.
who are interested in this
Okay.
topic, it would be really helpful.
Okay,
All
I
right.
will. Thank you so much for inviting me. It's a pleasure to be here. I think it's so important to talk about this more. Your podcast is amazing,
Thank
and I
you.
think it really helps just talking about it more openly because
Yeah.
those two
Yeah.
topics, self-harm and suicide, are
Very
so surrounded with
stigmatized.
yes,
Yeah.
stigma
Yeah.
and shame, and
Well,
it
thank you
can
for
be
helping me
different.
with that to break the stigma, right? Like knock down the barrier of silence.
Yes.
Thank
Thank
you.
you.